Recurrent pregnancy loss is actually an entity whereby women conceive but typically have a miscarriage. Oftentimes, this occurs in the first trimester. Our approach to that is to go through and get a very detailed history. The evaluation would involve specifically a uterine cavity evaluation. So we would typically do what's called a sonohystogram, which is an ultrasound that's done in the first 10 days of the month, where we actually put fluid inside the uterus and allows us to look very closely at the uterus for any type of fibroids that would be protruding, to any type of uterine polyps, for a uterine septum, which can be very amenable to treatment and really makes a difference in terms of preventing further losses. There's also blood work that's involved. Typically, these women are evaluated for lupus anticoagulant, antiphospholipid antibodies, autoimmune issues that would increase the probability of them having a loss. And then the last two blood tests would also be thrombophilia workup to look for any type of condition that would actually increase their risk of having blood clots, and these have also been found to increase the probability of having a miscarriage. Lastly is actually looking at ovarian reserve, is looking at their J3 FSH and estradiol to give you an idea of whether there's an egg quality issue, because that could also explain why they're having these losses.